Good afternoon. My name is Max Hausnick Jr., and I have the privilege of serving as the president and CEO of River Valley Health. On behalf of our board and dedicated staff, I want to extend a heartfelt welcome and thank you for joining us today. We are honored to host this press conference in partnership with the Pennsylvania Department of Health, and we're especially grateful to be joined by our distinguished guests. Today is a celebration of our shared commitment to public health and community resilience. At River Valley Health, our mission is simple yet powerful: to build health and bridge gaps by delivering comprehensive, high-quality care. As a federally qualified health center, we proudly serve communities across Lake Cumming and Clinton counties. Whether it's dental care, primary care, behavioral health, chiropractic, women's health, pharmacy services, or our MAT program for substance use recovery, we meet people where they are, helping them overcome barriers to good health. Every patient who walks through our doors is treated with compassion, dignity, and respect. Last year alone, we served over 17,000 individuals with more than 59,000 visits across our locations. These numbers reflect not just volume, but the trust our communities place in us. Thank you again for being here today and for standing with us in support of preventive care, especially as we enter respiratory virus season. Together, we're making health happen, one patient, one family, one community at a time. It's now my honor and privilege to introduce Pennsylvania's Lieutenant Governor, Austin Davis.
Thank you so much. Well, good morning, or afternoon. Good afternoon, everyone. It's so great to be here at River Valley Health. I was just saying how important federally qualified health centers are to our community as a whole, but before I was lieutenant governor, I was a state representative. And one of the first things you get to do as a state representative is decide where your district office is going to be. And I chose to make my district office attached to a federally qualified health center because this is truly where to meet people where they are. And I couldn't think of a better way than a partnership with a federally qualified health center. So thank you all for the work that you all are doing. I'm so thrilled to be here with Dr. Bogan, our health secretary. Dr. B, thank you for joining me here. And Commissioner Mike Humphreys, our insurance commissioner here for the Pennsylvania Department of Insurance. Both of them have been leading a lot of our efforts in terms of healthcare coverage and vaccines, and are really just doing some tremendous work on behalf of the governor and I. So we are grateful for both of your work. I'm grateful to be here with one of the best mayors in Pennsylvania, Mayor Slaughter. I don't have to tell you, but nobody works harder than your mayor. And I see him not just here in your community, but I see him at the state capitol, and I'm going to see him in Erie tomorrow, which is way on the other side of the state. But he really does a good job of getting stuff done for the good people that he represents here in Williamsport. And finally, I want to thank all the healthcare providers who are here today for all of the great work that you all are doing here in our communities. It wasn't that long ago that we were inundated in a pandemic, and everybody really recognized that the importance of healthcare providers and the work that they do to our community, and we have to make sure that we continue that recognition going forward now that we're on the other side of that. I've been eagerly awaiting today's events for a few weeks. I asked my team, when can I get my flu shot? My wife was kind of getting after me. She has hers, my daughter has theirs, and I said, I can't get mine. I got an event I'm going to do, and it was getting a little pushy in the Davis household. As a father and a son and a husband, I view it really as my responsibility to get vaccinated so I can keep myself and my family healthy and protected from the flu, which puts hundreds of thousands of Americans in the hospital every single year. Last year, more than 1,000 Pennsylvanians died from the flu, unfortunately. Because they're too young to be vaccinated, newborns and infants are incredibly vulnerable to the flu. So it's important to keep levels low in our communities to protect our youngest and most valuable Pennsylvanians, our young people. Just speaking for myself, when my daughter was born, my wife and I were incredibly cautious about who we allowed to see and hold her. We made everybody wash their hands and use hand sanitizer before we could even think about passing her over. I think actually for the first 8 months of her life, she didn't leave our house. That's old school. You know what I'm talking about. The baby doesn't leave in like the first year to build their immune system. It's equally as important to ensure that everyone in our family is vaccinated. Now, I truly believe in personal freedom, and Pennsylvanians should make their own personal decision on getting their annual flu shot. But I also believe in responsibility. As fathers, we need to take responsibility for protecting our families and communities, and this is another way that we can do that. Our administration, the governor and I, are working hard to ensure parents here in Pennsylvania are empowered and have options. I understand there is quite frankly a lot of chaos and confusion coming out of Washington, D.C. right now. Most of it from folks who openly don't believe in facts or science, but we know that President Trump, quite frankly, has shown that he doesn't necessarily care about other people's health and safety. And he likes to spread some conspiracy theories as it relates to vaccines and health. Secretary Kennedy from the Department of Health and Human Services has been equally as reckless and irresponsible. He's fired independent experts, and he's really damaged our healthcare infrastructure at its core across the country. But to be clear, these are not the people you should be listening to for medical advice. The President and Secretary Kennedy are trying to make it harder for everyone to access vaccines. Our administration is doing everything we can to share accurate information and empower Pennsylvanians to make the best decision for them and their families. That's why the governor called on the State Board of Pharmacy to protect access to the COVID vaccine for those who need it most at a time when the federal government is spreading misinformation and trying to hijack the approval process for vaccines. In addition, our state Department of Health has introduced general immunization guidance, which is driven by science and supported by experts. I'd like to bring up our health secretary, Dr. Bogan, who's an expert in this topic with years of pediatric medicine under her belt. And this is, it's really great because Dr. B and I get to work together now, but we also got to work together when I was a state representative, and she was the head of the Allegheny County Health Department where I live and represented. And I can tell you we were served incredibly well by her leadership at the Pennsylvania Department of Health. Dr. B?
Thank you so much. Good afternoon. Thank you, Lieutenant Governor and Commissioner Humphreys for being here. And a big thank you to River Valley Health for hosting today's event to help us encourage all Pennsylvanians to get their annual flu vaccine. So as Lieutenant Governor said, I'm Dr. Deb Bogan. I'm Pennsylvania's Secretary of Health. I know it doesn't feel like it with the warm weather we're having and the beautiful weather we're having, but respiratory virus season officially started on Sunday. So it's an opportune time to make an appointment with your local healthcare provider or pharmacist to get your annual flu vaccine. Before we know it, the weather will get colder. We'll all spend more time indoors, and spending time indoors with our friends and family in the holidays is lovely, but it's also an opportunity to spread infections very effectively and efficiently. So we know how to significantly reduce the risk of flu during the respiratory season. And the answer is get vaccinated. All of us here today are firm believers in the effectiveness and safety of the flu vaccine. In fact, the Lieutenant Governor, the Insurance Commissioner, and I will be getting our flu vaccines in just a few moments. We're getting vaccinated today because it provides the best protection against severe disease by boosting the body's natural defenses against flu germs that can make us sick. Not only are we protecting ourselves, we're also protecting our friends and family and neighbors because people who are vaccinated are less likely to pass the infection to others, especially people who are at increased risk of severe outcomes due to respiratory illnesses. I also want to remind people that it's important to get tested if you're symptomatic with flu-like symptoms. There are medications that your healthcare provider can prescribe to reduce the risk of severe outcomes, especially among those at high risk for serious outcomes like young infants and children, older adults, and people with chronic lung disease and other medical conditions. As the Insurance Commissioner will talk about in a few minutes, most insurance plans cover the flu vaccine at no cost. For people who are uninsured or underinsured, the flu vaccine is available through state health centers and at federally qualified health centers like River Valley Health. For children who qualify, the flu vaccine and other routine childhood immunizations are available at no cost through the Vaccine for Children's program providers, and there's a list of all of the state's Vaccine for Children's providers on our website. So as the Lieutenant Governor said, and as many of you know, I am a pediatrician, and for more than 3 decades, I treated children with the flu. Recently, the Centers for Disease Control and Prevention released last year's flu data, and it showed that 280 children across the United States died from influenza. That's more than usual, but that's a lot of children, half of whom did not have any underlying medical condition, and most of whom were not fully vaccinated. And I know there are parents out there, I've been a pediatrician for a long time, I know that parents are out there who do not see the need for their child to get the annual flu vaccine. To these parents, I'd say influenza, more commonly known as the flu, is typically responsible for more hospitalizations and deaths in the United States than any other vaccine-preventable illness. About 200,000 hospitalizations and thousands of deaths occur every year because of the flu. The flu vaccine causes only mild side effects that we expect and are normal, and therefore the benefits of influenza vaccine far outweigh any risks. So before I wrap up, I want to take a moment to discuss vaccines in general. We've all heard the conflicting narrative going on lately about the safety of vaccines. I'm here to tell you that vaccines are safe and effective. As a pediatrician, I provided medical care to infants and children with what are now vaccine-preventable illnesses. Some of those children were extremely ill and eventually had to be hospitalized. And over my career, I got to see firsthand how the introduction of new vaccines changed our medical practices, reduced pain and suffering, and saved countless lives. So we at the Department of Health want all Pennsylvanians to have available clear, evidence-based information about vaccines for children and for adults. So last week we published new guidance, which has been supported by the state's boards of medicine, nursing, and osteopathic medicine. This guidance will help keep vaccines accessible and protect the health of Pennsylvanians. If you have any questions about vaccines, I encourage you to visit our website, health.pa.gov, to learn more, and talk to your primary care health provider. Those are the people that we trust, who you have relationships with. That's who you need to turn to for information. Your primary care provider knows when and what vaccines you and your children need to remain healthy and safe. So again, don't forget to get your flu vaccine this year. And now I'd like to invite Pennsylvania's Insurance Commissioner, Mike Humphreys, to discuss insurance coverage for flu vaccines.
Thanks. Thank you, Dr. B. Thank you, Lieutenant Governor Davis. And thank you to the Department of Health and River Valley Health for organizing today's important event. I am Mike Humphreys. I have the honor of serving as the Pennsylvania Insurance Commissioner. Our message is simple. Cost shouldn't be an obstacle to any Pennsylvanian that wants a flu vaccine. Pennsylvanians should not forego the flu vaccine because they fear an unexpected charge. For insured Pennsylvanians, your health insurer must cover the full cost of certain recommended vaccines. If you go to an in-network provider, you will not have to pay anything, including a copay or a deductible, for the flu or COVID vaccine if you have comprehensive major medical insurance or small group market health insurance, including coverage available through Pennsylvania's state-based exchange that you all know as Penny, including if you have coverage provided through your employer, through Medicare, or through the Medicare Advantage coverage, or through Medicaid or the CHIP program, or for state employees, the PEBTF program. Your insurance company or healthcare provider should be able to help you find a vaccine location that is in-network. And you can call your in-network provider ahead of time to make sure you will not be charged for the vaccine or the office visit associated with the vaccination. We understand that there's a lot of uncertainty right now when it comes to health insurance coverage. Whether it's the potential rise in health insurance premiums or misinformation centered around paying out of pocket for health services that were once covered under a consumer's health plan at 100%, we understand that confusion. One thing we don't want consumers to be confused about, though, is immunization coverage. National trade groups representing health insurers here and across the country have publicly stated that health plans will continue cover recommended immunizations, including the updated COVID-19 and influenza vaccines, at no cost to consumers through the end of 2026, so 12/31/26. And PID expects Pennsylvania's insurers to continue to cover vaccines without cost sharing or the imposition of other administrative barriers consistent with that coverage approved for sale at the beginning of 2025 and with the promise of coverage made to the insured at the time that they purchased the policy. So that's today, that's through this year, and we're approving plans for next year to cover the 2026 calendar year as well. Additionally, you may contact the insurance department for help. If you're currently uninsured, there's no better time to obtain health insurance coverage. For anyone looking for coverage for 2026, the open enrollment period for Penny will start on November 1st, and you must apply for coverage by December 15th in order to secure that coverage for 1/1/2026. And you can learn more about Penny at penny.com, and that's PENNIE.com. Penny offers free help by phone and in person across the Commonwealth. Again, I want to stress that the insurance department is here to help. If you have questions about your insurance or about coverage, what's going to be covered, at what cost to you, we encourage you to reach out to pa.gov/consumer or pa.gov/insurance. Thank you again, and I'd now like to turn it over to Mayor Slaughter.
Well, good afternoon, and thank you, Lieutenant Governor, Secretary Bogan, and Commissioner Humphreys, Max, and the team here at River Valley Health and Dental for hosting this event here today. And I would reciprocate to Lieutenant Governor, thank you for those warm remarks, that the Shapiro-Davis administration, I don't think I can overstate the importance that they play here in Williamsport and the projects, technical assistance, and just their general support of the residents in the city of Williamsport. So thank you to you and Governor Shapiro for that support. And thank you for the opportunity to share a few very brief remarks here today. As we head into flu season, I want to take a moment to talk about something that's pretty simple, but that can make a big difference, as you've heard, and that's getting your flu shot. Getting vaccinated, it is a personal decision. However, I also want to encourage folks to think about this not just for themselves, but for their families, their coworkers, and our community as a whole. A flu shot helps protect not just you, but the people around you, especially the elderly, young children, and those with underlying health conditions. Also, if you're uninsured or underinsured, as Commissioner Humphreys just mentioned, you can still get a flu shot. Local state health centers and federally qualified health centers offer flu vaccines regardless of insurance status, and I think that is a very important point to make. And my office has received calls about that because it is confusing a little bit in today's day and age, as we heard. So they have to offer those vaccines regardless of your status. So don't let that cost be a barrier, as these resources are here for you. So let's all do our part to stay healthy this flu season. And it's now my privilege and honor to introduce Christine Kavanaugh from River Valley Health and Dental.
Thank you. So I'm Christine Kavanaugh. I've been a provider for 30 years also, Dr. Bogan. I'm a nurse practitioner, registered dietitian. I'm not going to reiterate everything that Lieutenant Governor and Dr. Bogan have said. I agree with all of their points. I'm about prevention. I work in pediatrics. I work 10 to 6 on Tuesdays. I've given 4 influenza vaccines this morning. My patients have been very accepting, so that's wonderful. I'm about prevention. It's about getting good sleep, eat well, take a walk, educate yourself, and do what the science shows. The The data behind the flu shot is excellent, and I will share that with my patients, and it's a shared decision-making process. But I really urge everyone to get the flu vaccine. It's another prevention. Like they all said, it helps me, it helps the individual, it helps my family, my friends, my patients, my community. It's really important, especially for those that are vulnerable, being the very young and the very old, and those with immune compromised conditions. So I will turn it back over to Dr. Bogan. If anyone has any questions, please.
Thank you. Just to conclude, Secretary Bogan, we'll bring you back up for all the hard questions for Dr. B. But I want to recognize Representative Flick, who joined us today. Representative, thank you for being here and for your leadership. Please give him a round of applause. We also have County Commissioner Messina, who's with us as well. Thank you for your hard work, for being here as well. Thank you. I got my start in county government, so I know how hard you guys work. Thank you for being here, and we'd be happy to take any questions, if there are any.
I know you're dying. Go ahead.
Come on.
Any questions? All right, I'll give you the answer.
Do you feel that there is a greater need to educate the public this year because of the misinformation that's coming out?
Yeah, I'll just take that. I think there's always a need to educate the public. Everyday folks have so many things going on in their lives. And to your point, there are so many different mediums in which people are getting their information. And a lot of it is disinformation. And so I think people need to hear from trusted voices. I believe I'm a trusted voice, but I think Dr. B and the healthcare professionals are the much more trusted voices in our community that folks need to be hearing from, which is why we're doing this event today, why the governor and I are continuing to talk about this and highlight it to encourage as many folks to take advantage of vaccines as possible. All right. Well, thank you all for being here. I'm going to go get my flu shot. Anybody else want to join me? Yeah. Oh, great. Wonderful. Wonderful.
Only a couple dental schools and there's only a couple that work in those things, but I don't understand why classroom can't be done, the classroom work can't be done remotely. Where you just set them up in an office here and sit 2 or 3 of them together in an office, take with their, get some kind of the other thing is labor and industry has apprenticeship programs, you know what this?
Everybody who really needed the help was donuts. And so they could literally just go right next door for health, birth certificates, everything that they needed. We were there for 5 years.
One family, one community at a time. It's now my honor and privilege to introduce Pennsylvania's Lieutenant Governor, Austin Davis.
Well, good morning. One of the best mayors in Pennsylvania, Mayor Slaughter. I don't have to tell you, but nobody works harder than your mayor. And I see him not just here in your community, but I see him at the state capitol, and I'm going to for all of the great work that you all are doing here in our communities. It wasn't that long ago that we were inundated in a pandemic, and sanitizer before we could even think about passing her over. I think actually for the first 8 months of her life, she didn't leave our house. That's old school. You know what I'm talking about.
But it's also an opportunity to spread infections very effectively and efficiently. So we know how to significantly reduce the risk of flu during the children, half of whom did not have any underlying medical condition, and most of whom were not fully vaccinated. And I know there are parents out there, I've been a pediatrician for a long time, I know that parents are out there who do not see the need for their their child to get the annual flu vaccine. To these parents, I'd say influenza, more commonly known as the flu.
That support. And thank you for the opportunity to share a few very brief remarks here today. As we head into flu season, I want to take a moment to talk about something that's pretty simple, but that can...
Everyone say flu shot.
Flu shot.
Got it. Thank you.
All right, thank you guys. Thank you. Like, come
No,
on.
it's the only
That
way to do
hour
it.
is so much better.
It's the only way. Thank you.
That's it.